Hello, you're welcome to another episode on Dr. B's channel. This channel gives you information, shares life nuggets, and just helps you to live a good and full life. Before I go ahead, forgive my manners, Happy New Year, because this is the first episode that I'm creating this year. And I want to start with health screening in women, particularly cancer screening. It's the C word, and culturally, especially where I come from in Nigeria, many people don't like to hear about it. It sounds like, oh, you are about to fill their mind with evil, say negative things. But no, the whole idea is not to create fear. The idea is to give information that empowers so that you can take the right decision. Cancer screening is not scary, I tell you. Late detection of cancer is very scary because statistics have shown us that those who are screened for cancer and are detected to have cancer in stage 1 or sometimes early stage 2 have higher chances of being cured of cancer, and there are living testimonials to that effect. So people have been screened to have stage 1 breast cancer, and they went through treatment for it and they are cured, and 10 years after that they are still alive, 15 years after that they are still alive. These are people that I know personally. So cancer screening is not about fear, it's about early detection, it's about preventing complications and saving lives. So today this episode is focused on women cancers. I will do another episode to focus on the men, and today's episode is actually about the 3 common cancers in women. The first is breast cancer, the second is cervical cancer, and the third is colon cancer. Yeah, you might say there are so many other cancers, yes, but like I said, these are the common ones, and common things occur commonly. There are other cancers that can be screened for. We have endometrial cancer, we have ovarian cancer. I'm talking about female cancers now. Ovarian cancer, some skin cancers, but usually this is with some family history, or there are indications why you want to check to be sure that a person is not having those symptoms. But today the focus is on breast cancer, cervical cancer, and colon cancer. So breast cancer. Breast cancer is still the most common cancer in women all over the world, and is the second leading cause of death after lung cancer in the US. So breast cancer is quite common. And the way to screen for breast cancer is to do a mammogram. Every woman 40 years and above is recommended to have a mammogram every year or every 2 years, as the case may be, because some government-run healthcare system differ from out of pocket, differ from private insurance. So find out what obtains. But generally, mammogram is annually, that is every year once a woman is 40 and above. A woman with a history of breast cancer in the family, whether a mother, one of our aunts, or someone close who has had breast cancer before, should have the screening start 10 years earlier. So that means that woman will start to screen for breast cancer at the early age of 30. And that's why you wonder, I've known people who had breast cancer in their 30s. Yes, if you dig deep enough, you find out that there was probably a family history. So there's a need to follow up closely on that. And that is why in some of previous short skits I've done, I've talked about the need to talk with your doctor closely and get all this information out, because they help you to identify your risk and tell you what's worth it. Another thing that helps with breast cancer screening is actually having your breast checked physically by a physician. During your annual wellness check, the physician should check the breast and check for any abnormalities, check for lumps, and every other thing that you would examine the breast for. You can also learn to do that yourself, and it is recommended that every woman should self-examine her breast, typically 5 days thereabout after the menstrual cycle, because at that time the breast is less engorged and you can actually feel the normal breast tissue. This is so because when you get used to examining your own breast, when something is off, when you feel something unusual, you know that this is not how this feels normally, and that rings an alarm and makes you go for further check. It might be nothing, but when you know what your normal breast feels like, you know when something is off. That is the whole idea of self-breast examination, and it helps you to self-report even when your mammogram is not yet due. The second I want to talk about is cervical cancer. The good news is cervical cancer is actually preventable. For women who are not yet sexually active, and I would say girls, because once women are older or they are married, they start to engage in sexual activity. But for young girls, they can get the HPV vaccine. That's the human papilloma virus vaccine. This vaccine helps to prevent cervical cancer in women. But if you are not fully vaccinated with the HPV vaccine and you are 18 years and above and sexually active, you have to get a pap smear done every 3 years. Get a pap smear done every 3 years to screen for cervical cancer. The last cancer I'll talk about is colon cancer. Colon cancer is cancer that develops in a part of the large intestine called the colon. It is screened by doing a colonoscopy. A colonoscopy, just from the word, is a scope, something that looks into the colon and sees that the colon is healthy. Sometimes during a colonoscopy, they might find polyps, and then those polyps are taken out, and there's a test on them to check if they are precancerous. If they are precancerous, your doctor might want you to do another colonoscopy before 10 years, because the recommendation is every 10 years. But if there are precancerous polyps, they will tell you to come earlier for another colon cancer screening. So that is it about colon cancer. And another personal thing I would say is I have known people who had colon cancer detected early, and they are still alive today, and it's been about 20 years. So it's always better to screen for these things. I'm hopeful that none of us comes down or is detected to have cancer, but at least what is within your power, you should do. And that is why this information is coming out to you. Please share this information with women you care about, friends, your wife, if you're a man, your sister, because every woman should know when to go get screened for some of these cancers. If you have questions, you can post them in the comment section, and I will be happy to answer them. But remember, your health is your greatest asset. Once your health is off, every other thing falls off. So take care of yourself. Take charge of your health. Go get screened this year if you are due for any of them. You might say, oh, I'm already so old and I've never done them and I feel okay. It's fine. The best time to start is now. Or better still, check with your doctor if you still need to do it, because there's an age where some of the screening will no longer be necessary. But that's for you to check with your doctor and be informed about. So stay well until the next episode. I remain Dr. B. And if this information was helpful to you, please like this channel, subscribe to it, and share with people in your circle. Bye.